Hello, everyone. It's Wednesday, January the 6th. Sorry we're getting started a little late, but there's lots and lots of moving parts and a lot of things going on. Very regretfully, I've got 85 additional deaths that have happened since Monday. I'm going to read through those in just one second, and again, I ask for your prayers and thoughts for all these great people and all absolutely their loved ones as I go through it. And I'll do that right off the get-go right now, and that's what I should do. But our 1,397th death is an 88-year-old female from Monongahelia County. Our 1,398th death, a 69-year-old male from Hancock County. Our 1,399th death, a 71-year-old male from Kanawha County. Our 1,400th death in West Virginia is a 56-year-old female from Hampshire County. Our 1,401st death, a 77-year-old female from Hampshire County. Our 1,402nd death, a 73-year-old female from Fayette County. Our 1,403rd death, a 76-year-old male from Mercer County. Our 1,404th death, a 78-year-old male from Harrison County. Our 1,405th death, a 77-year-old female from Greenbrier County. Our 1,406th death, an 82-year-old female from Hancock County. Our 1,407th death is an 83-year-old female from Greenbrier County. Our 1,408th death is a 94-year-old female from Greenbrier County. Our 1,409th death, an 81-year-old female from Berkeley County. Our 1,410th death, a 62-year-old male from Berkeley County. Our 1,411th death, a 64-year-old female from Kanawha County. Our 1,412th death, an 80-year-old male from Lincoln County. Our 1,413th death, a 63-year-old male from Monongahelia County. Our 1,414th death is a 76-year-old female from Berkeley County. Our 1,415th death is a 96-year-old female from Monongahelia County. Our 1,416th death is a 90-year-old male from Hancock County. Our 1,417th death is a 93-year-old female from Ohio County. Our 1,418th death is a 79-year-old female from Mercer County. Our 1,419th death is an 87-year-old male from Tucker County. Our 1,420th death, an 88-year-old female from Hancock County. Our 1,421st death is a 96-year-old female from Monongahelia County. Our 1,422nd death is a 71-year-old female from Harrison County. Our 1,422nd death is a 71-year-old female from Hampshire County. Our 1,423rd death is an 88-year-old female from Monongahelia County. Our 1,424th death is a 78-year-old female from Monongahelia County. Our 1,425th death is an 86-year-old female from Berkeley County. Our 1,426th death is a 60-year-old female from Mercer County. Our 1,427th death is a 70-year-old male from Monongahelia County. Our 1,428th death is a 70-year-old male from Mercer County. Our 1,429th death is an 87-year-old female from Greenbrier County. Our 1,430th death is an 85-year-old female from Hancock County. Our 1,431st death is a 71-year-old male from Fayette County. Our 1,432nd death is an 81-year-old male from Wood County. Our 1,433rd death is a 92-year-old male from Kanawha County. Our 1,434th death is a 79-year-old male from Monongahelia County. Our 1,435th death is an 89-year-old female from Hancock County. Our 1,436th death is a 97-year-old female from Marshall County. Our 1,437th death is a 73-year-old female from Cabell County. Our 1,438th death is an 86-year-old female from Cabell County. Our 1,439th death is an 87-year-old male from Kanawha County. Our 1,440th death is a 77-year-old female from Cabell County. Our 1,441st death is an 86-year-old male from Jackson County. Our 1,442nd death is a 79-year-old female from Marion County. Our 1,443rd death is an 88-year-old female from Kanawha County. Our 1,444th death is a 43-year-old female from Raleigh County. Our 1,445th death is an 80-year-old female from Mercer County. Our 1,446th death is an 81-year-old male from Kanawha County. Our 1,447th death is a 75-year-old male from Barber County. Our 1,448th death is a 59-year-old female from Wood County. Our 1,449th death is a 74-year-old female from Mineral County. My goodness, it's just really sad. Really, really sad. Our 1,450th death in West Virginia is an 85-year-old male from Kanawha County. Our 1,451st death is a 95-year-old female from Mineral County. Our 1,452nd death is a 64-year-old male from Putnam County. Our 1,453rd death is a 77-year-old female from Monongahela County. Our 1,454th death is a 66-year-old male from Monongahela County. Our 1,455th death is an 82-year-old female from Harrison County. Our 1,456th death is a 62-year-old male from Wayne County. Our 1,457th death is a 97-year-old male from Wood County. Our 1,458th death is a 67-year-old female from Cabell County. Our 1,459th death is a 97-year-old female from Mineral County. Our 1,460th death is an 89-year-old female from Hancock County. Our 1,461st death is an 89-year-old female from Mineral County. Our 1,462nd death is an 81-year-old female from Cabell County. Our 1,463rd death is a 78-year-old male from Cabell County. Our 1,464th death is an 81-year-old female from Upshur County. Our 1,465th death is a 73-year-old male from Hancock County. Our 1,466th death is a 90-year-old female from Morgan County. Our 1,467th death is an 82-year-old female from Mercer County. Our 1,468th death is a 93-year-old female from Mercer County. Our 1,469th death is a 49-year-old male from Cabell County. Too young, way too young. Our 1,470th death is an 82-year-old male from Kanawha County. Our 1,471st death is a 75-year-old male from Hancock County. Our 1,472nd death is a 73-year-old female from Fayette County. Our 1,473rd death is a 79-year-old male from Kanawha County. Our 1,474th death is an 89-year-old female from Cabell County. Our 1,475th death is an 80-year-old male from Wood County. Our 1,476th death is a 67-year-old female from Wood County. Our 1,477th death is a 96-year-old female from Hardy County. Our 1,478th death is a 79-year-old male from Kanawha County. Our 1,479th death is a 78-year-old male from Kanawha County. Our 1,480th death is a 65-year-old male from Tucker County. And our 1,481st death in West Virginia is a 63-year-old female from Brooke County. It's incredible. It's unbelievable. And please, please, please keep them in your prayers. We can't let them just be numbers. Please keep them in your prayers. In the last 24 hours, we've had 1,516 positive cases. Our positivity rate is 11.65 in our daily positivity. Our cumulative is at 5.18. Our active cases are about 27,500, and our recovered cases are about 65,500. We have 818 hospitalized in West Virginia now and 217 in the ICU units, and we tested 11,500 plus yesterday. And our RT number is at 1.05, and that's tied for 24th best in the country. Like I've said a bunch of times, that just bounces all over the place. All of our counties are in the red and the orange, and I remind everybody over and over, as I've done over and over, and that is just this. If you're 65 years of age, if you're 50 years of age, but especially 65, and you have any kind of problem, what I've called a sniffle or a headache or tiredness or whatever it may be, go get a test. Go get a test. We can stop you from being one of these numbers that we read. We can absolutely heal you very quickly with antibodies for the most part. I'm not speaking 100%, but I'm absolutely speaking that we can really do good if we can catch it early enough. Everything tells us, and you hear the age of the people that we go through over and over and over, it tells us just this. It tells us that this disease attacks the elderly, does it not? Now, I want to deviate just a second. And I want to talk to you about the things that are going on, that are troubling to me and at the same time rewarding to me and an honor for me. But along the way, and we've been at this now for, I guess, going on close to 10 months. And you developed a real trust in me. And there was a thing that just came out, with people at the Greenbrier Hotel, and I'll get into that in just a second, but then you have people that are promoting the cast of doubt. I want to just tell you just this. Along the way, there has to have been a lot of really tough decisions. Tough decisions made. Whether those decisions were to, close our nursing homes to visitation, or make sure that we were the first in the nation to test all of our residents and staff at our nursing homes. The same for the assisted living. First in the nation. The same with absolutely getting out our vaccines the fastest. First in the nation. And I have pushed and pushed and pushed to say, still not good enough. We've had to watch really closely after all the economics of our state. And you entrusted me to do that. I took care of the cities and the counties. I took care of your CARES money. And we're getting through it the very, very best we possibly can. Now, the toughest decisions of all, always, are the schools, whether we should play sports. Today, we're embarking upon a new operation that I named yesterday with the National Guard called Operation SOW, or Operation SOW, Operation Save Our Wisdom, that really gave hope to the people that are 80 years old or older. And now we're going to back right up behind that and go to the 70-year-olds and into the 60-year-olds. And I'm going to tell you, by God, we're going to stop this thing. And we're going to stop it together, and we're going to stop it without a backlog of vaccines sitting in a warehouse, as is happening with a lot of different states. We're not going to let that happen in West Virginia. Now, with all that being said, as you make a decision about going to school, there are some that are going to become upset. And then there are some that are going to cast stones, are they not? Well, they are. And, from time to time, the motivation, we lose so much focus with what we should really dial into. I'll get to the Greenbrier in just a second. But I want you to know just this, that the absolute most important things always to all of us are how we take care of our people, how we take care of our kids, how we absolutely are on top of every single aspect of what we're doing here. Now, I want everyone to know, without any question whatsoever, that I have said this repeatedly, and I'm not going to say this again after today. I want you to know that there's no way on earth that I'm going to do anything whatsoever in this capacity, in this job, to benefit me. There's no way. No way. I've not done that from day one, and I won't do that till day end. That's just all there is to it. Now, you need to ask yourself just this, and this is a very, very interesting dilemma. From the standpoint of the Greenbrier, and I think the Greenbrier, they're telling me the Greenbrier just came out with a press release, and I'd like to get a copy of that, if anybody's got it, and I'd like to see what they've said in the press release. But from the standpoint of the Greenbrier, I want you to know just this. I have been accused often of running my family businesses. Man, I've had rocks thrown at me for running my family businesses. Well, I'm going to tell you, I run your state as your governor. And from the standpoint of running my family businesses, especially in this situation, I had no clue. I mean, you may throw rocks at me if you choose to do so, but I was lying in my bed watching the ball drop, and listening to J-Lo sing. Now, I had no clue about all the preparations, all the different things done, not one clue in the world as to what's going on. Now, so we got to do it one way or the other. I mean, you talk about damned if you do and damned if you don't, if there's no way on earth that I'm having anything to do with the business, and then people say, well, why in the world didn't you know? This is like, what's the difference with me owning some stock in General Motors and General Motors doing something wrong, and then I'm supposed to know about it? Well, I didn't know about it. That's all there is to it. I knew nothing about it. Now, as far as, let me tell you something that happened a long, long time ago. It happened with Paul Harvey and President Reagan. President Reagan was in a situation, and he said, I just messed up. And here's what Paul Harvey said, and this is something that absolutely we should consider here. Because just like I just said, you're damned if you do and damned if you don't. If you knew what was going on with the Greenbrier, that's one thing where you shouldn't have been doing that. Well, I didn't know. So I was doing what I was supposed to do there. I didn't know. But then all of a sudden something comes up and I should know. Well, Paul Harvey one time said on his broadcast, and a lot of us that are my age know, and remember Paul Harvey, and he was terrific on the radio. And he said, for 7 years, the Democrats have been trying to convince the American people that Ronald Reagan didn't know what he was doing. And now he comes out and says he can't remember something, and the Democrats say he's lying. Well, that's really what you have. In all honesty, if I could just now, I don't know if I could get the, oh, okay. Hold on, y'all just sit with me just 1 second. Okay. Now, I haven't seen this. I'm gonna read this to you, though. This is from the Greenbrier. It says, since the beginning of the COVID pandemic, the Greenbrier has always been in strict compliance with the health guidelines. We continue to be in constant contact with the Greenbrier County Health Department regarding the guidelines, contact tracing, social distancing, and mask wearing. During the evening, all guidelines, I guess this evening that we're talking about, during this evening, all guidelines were strictly complied with, including social distance dining, no live entertainment or dance floors, and face coverings were required at all times when not actively eating or drinking. In all dining venues, the chairs were spaced 6 feet apart. The casino followed all West Virginia lottery regulations, including no more than 2 patrons at a table. Patrons were not allowed to touch the cards, and every other slot machine was disabled to have social distancing. All these protocols were expanded across all restaurants and bars across our facility. Upon review of the published video from the New Year's Eve gathering in the upper lobby, some guests in attendance were not wearing face coverings. Those guests, it appeared, were to be actively drinking without a face covering, which is allowed per the guidelines. One of our event managers said that these people that were at that gathering in the upper lobby they gathered around 11:45 p.m. and were dispersed by 12:03 a.m. So in other words, in 18 minutes, they gathered and were dispersed. The Greenbrier has always taken the COVID pandemic seriously and its effects on our guests and staff very seriously. We continue to screen all team members, guests, vendors, and contractors before they're allowed to enter the resort property. Now, I want you to know this. Man, I want you to know this loud and clear. It's tremendously important to me, that you trust me, because I'm never going to tell you anything but just the truth. And I know clearly as I could possibly know that we got a lot of people out there that are really hurting. And a lot of restaurant owners and all whatever it may be are really hurting. You know, I can tell you as far as this event goes, I wasn't there. And I can also tell you that I have instructed the people at the Greenbrier, I have totally instructed those people at the Greenbrier to continue their investigation in every way, and if absolute disciplining is in order, to take those actions and take them now. I have also told the Greenbrier that no matter how good they thought they were doing, to double down on all their practices, as I would tell all of our businesses across our state. I read 85 names today. And absolutely, it's serious stuff. Now let me just say one other thing real quickly, and that's just this. You know, there's been some things brought up, well, should we go back to school? Well, and without any question, we should be going back to school. Now, along the way, as I've done over and over, I am a real believer in education in this state. I will promise you to God above, there has never been a governor that's been more supportive of the education departments and all the educators across our state than me. There's no way. There's no possible way. I'll continue to talk to our educators, but I will not absolutely be bullied around by the teachers' unions. I will continue to talk to our educators because I have supported their effort in what they're doing, and I want them to continue to do greatness across this state. They are so important to us right now. So important. That's why I took the initiative to start trying to vaccinate them, and I'll get to that in just one second. But without any question whatsoever, I absolutely will stand by talking to the educators and taking their advice on many things and taking them into consideration as we move forward. As far as sports, one of the questions the other day was, Governor, how do you feel about telling an assistant coach or whatever that they're not going to be able to play and you've got this terrible event going on at your place? Well, first of all, I go back to just this. If you want me to know about the event and everything, then I got to know what's going on in the businesses, and there's no way on God's earth that I can do this and do that too. Now, that's one thing. And I've been criticized for doing that, which is ridiculous. And this is pure proof of the ridiculousness of it. I have been criticized for running my own businesses, and now I am at home in the bed watching on TV, and lo and behold, and have no knowledge whatsoever, and now I'm criticized because of that. Now let me just tell you, and just tell you just straight up as it can be though, without any question in regard to sports today, somebody somewhere just answer me just this simple question. Please lay aside what's going on at the Greenbrier or what's going on Planet Mongo. Just answer one question. Do you really believe today, that we ought to be playing high school indoor sports when grandmas will want to come and everything else? Do you really believe that we ought to have our kids and bus drivers and whatever it may be, parents or whatever, traveling all across our state when we saw what happened with football and volleyball and all the sports? Do you believe, with 85 people dying today, do you really believe we ought to do that, irregardless of anything? Irregardless of anything. Now, I'm telling you, just as straight up as I can be, if our supervisors at the Greenbrier were the least bit derelict in their duties, they'll get disciplined, and they'll get disciplined big time. And that will happen immediately. And the only reason that I'm in it is because you've pushed me back to find the knowledge. Now, I told you this too. I told you that we would disclose names and everything, and after thinking really hard about that, is that fair? Is it really fair, and is it right to do? Well, it's not right to do. That's all there is to it. Jill Justice is running the Greenbrier. Elmer Capulse is working right with her. And those people beyond that, those people really and truly, to mention other people's names and everything, I think is really counterproductive to those people. I can assure you without any doubt that the protocols that the Greenbrier has been taking have been very, very good. And I can assure you without any doubt that if they genuinely screwed this up, there'll be you know what to pay. And without any question, I will assure you beyond all doubt that we will double down in every way at the Greenbrier for them to do better and better and better. And I also will assure you without any doubt that I understand without any question how bad we're hurting all across the state. And I'm trying with all in me every single day to make it go away, to make it do better. Absolutely, I am trying with all in me, and I'll continue to do just that. And I'm sorry that took so long. Let me go back to just some other things and finish this up. You know, today we're still continuing to be first or second in the nation in the current administration of our vaccine. We have a total of 109,000 in West Virginia now, and we have a total out of about 61,000 that have gone out to people. We have we absolutely are moving forward with a plan to even do much, much, much better. And here it comes. Here's what it's going to be. It's Operation SOW, Save Our Wisdom, which is our older people primarily, but it is absolutely targeted at our people that are 80 and above, and our faculty and our service personnel 50 and above, and absolutely without doubt we will double right back, and we will get everyone that is absolutely faculty or service personnel, every single one, irregardless of age, and we'll get them immediately. You know, the ongoing supply, of our vaccine through our local health departments is out there. We have events planned right now, and I think that these events are going up on Thursday of this week, I believe. I think that's correct and everything. And they are in Berkeley County. They're in Williamson. I mean, are you going to keep up with me here, Jordan? Okay. They're in Berkeley County, they're in Williamson, they're in Bluefield, they're in Beckley, Wyoming County, Kanawha County, Wood County, Morgantown, and Wheeling. On top of our local health departments doing their rounds of vaccination appointments and/or clinics, we are going to hold 10 vaccination clinics that I have just read off across our state for our 80-plus population. If for some reason you can't get to one of these clinics or all of your appointments are already taken, just know that more vaccines are coming each week and the local health departments will regularly be receiving it. We should make sure all West Virginians have access to a vaccine as we work through the allocation in phases. Now, understand just this, and I'll break it down and make it really simple. States all across this country, we started down a pathway to develop a plan. And we were going to develop a plan on how we were going to get through all of our healthcare community and all of our first responders and all this and everything. And we were going to get this done, and we were going to get this done by, first of all was the nursing homes. We got it done phenomenally. And then all of a sudden it started to maybe look like it was kind of bogging down just a little bit. The bottom line of the whole thing is the very thing that we ought to all be the most concerned with that I was preaching to the mountaintops was age, age, age. Because if we can vaccinate our elderly, that's who I'm reading every day. And so all of a sudden we pivoted, as we've done many, many times. And we pivoted to the fact that not only were we going to be able to get our kids back in school, we were going to test our teachers and test our service personnel, but we were going to give real hope to the older people. That's to save our wisdom. That's the wisdom that I talk about all the time. We can't let the wisdom just die away. We've got to have the wisdom for our young that are coming on. And so all these people that have that wisdom, we're trying every way in the world to save you today because you are so precious to us in every way. Now, with that being said, what do we got to do? Here's what we got to do. We've got to allocate so many vaccines to our elderly while still being able to maintain and do everything else. It sounds really familiar to me. When we had to fix all the potholes and still keep the Roads to Prosperity program moving, we did it. We didn't just go build new bridges and fix new stuff. We did it. And so in this situation, we've got to make sure that we're fixing all the potholes and all the elderly and everyone we can possibly help. And that's what we're doing. Now, as far as the vaccines for our teachers and staff, they will begin on Thursday, January 7th, and all the information on where and when you will receive the vaccine will be distributed through the Department of Education directly to the superintendents of each county. In addition to this, we are continuing to vaccinate those in phases 1 through D this week, healthcare workers and higher ed staff who are 50 and above. The long-term care facilities, additionally, the long-term care staff and residents started receiving their second dose this week. Todd Jones, who is the president of AMFM, Nursing and Rehabilitation Centers, is joining us today to talk about this success, and I'm going to go to you, Todd, right now.
Okay, thank you, Governor. We're very excited to have the second round of the Pfizer vaccines being rolled out today. West Virginia is the first in the country to provide the both doses to the long-term care community, which is a tribute to the plan that the folks here have put together. Our partner, Lifetree Pharmacy, in addition to vaccinating our 19 facilities, will support an additional 48 clinics at other long-term care facilities and provide over 6,500 employees as well as residents all across the state with their second dose over the next 3 weeks. In addition to that, we believe that there would be about an additional 600 employees and residents across the state to receive their first dose during these clinics. Many states have not even begun their process. A lot of the long-term care facilities will not receive their first dose until either the end of this month or the 1st of February. So where West Virginia is right now is and leading the country in long-term care is very exciting. We've been contacted by folks all over the country asking us, what's West Virginia doing? You guys seem to be rolling out and are doing very well. So it's very nice to be leading the country and have some of the largest counties in the entire country calling West Virginia, asking us how we've been successful. One thing I wanted to mention, I talked about the last time. My mother is a resident at Cabell Healthcare Center, has been for 3 years, and her and I together received our second dose of vaccine this morning, just a few hours ago. Not only does this mean a lot to me professionally, but personally as well. And, this is a very safe vaccine. I urge anyone and everyone to take this vaccine as soon as it is made available to you, so we can try to put this pandemic in our rearview mirror. And I thank all of the folks that are on this call for their great work that they have done in helping roll this out to the long-term care community, and proud to be a part of this and leading the country and getting our elderly vaccinated. So thank you, Governor.
Okay, Todd, thank you so much. And I got to say this before we go any further, but the screen just flashed with all the panel, all the people, all of our experts on the thing. And what is this sweater vest that our general has on today? I mean, what is that get up? I mean, for crying out loud.
Governor, my wife picked that out.
Well, then I'm not saying anything else. Okay, let me go back to this, and I'll try to get through this stuff as fast as I can. The COVID vaccine stuff is that's online and everything. You can see all that and everything. There's no point in me going back through all this. From the standpoint of the vaccines, we need to take the vaccines, everybody. I mean, don't be afraid of this. For crying out loud, let's take the vaccine and keep moving. I mean, for crying out loud, just think about the number of people that we gave vaccines to that were in the nursing homes and the staff. Whom have you heard that's had an adverse reaction? Do you not see that the probability of you getting this terrible disease and having more than just an adverse reaction? Absolutely, this vaccine's safe. Take it. That's all there is to it. Like I said, if you get feeling the least bit bad, the antibodies are sitting here ready for you and everything, but we got to know you're positive test, and so go get tested. All the testing information's up on the screen and everything. The school outbreaks are very minimal because we're not in school and everything. From the standpoint, they've been minimal all along. From the standpoint of our long-term care facilities, we've got 118. Our churches have 16 outbreaks, 12 counties. I always read the counties: Greenbrier, Harrison, Jackson, Marion, McDowell, Mingo, Monongahela, Nicholas, Raleigh, Summers, Upshur, and Wyoming counties. Corrections, we're down a good bit. We're down. We got 400 active inmates. That's down 200, and there's no point in going through each place and everything, but we're doing better there. Our face coverings, we've got to wear a mask. I mean, you've got to wear your mask. Get your flu vaccine and give blood, please. From the standpoint again of our teachers, all I say is just this: is from the very first day of the state, I mean, just give me a break. From the first day of the state, I said we need to make education our centerpiece. You know why we needed to do that? We needed to do that to start beginning to mold and change a new image of West Virginia. Well, we did that, and we've done all kinds of different things. So as we prepare for the 19th of January and everything, we're going to prepare and hopefully, you know, we're going to be going, and absolutely, hopefully, all goodness is going to happen. And I'm going to continue to listen, and I thank everybody from the Department of Ed to all of our teaching community and everything. And so I'm just real excited and everything to get our kids back in school. We had an economic development announcement the other day on Monday about Speedway Motors coming to West Virginia and developing a plant in the Eastern Panhandle. It's great stuff and everything. Going to bring 25 jobs. That's really good. We had our National Guard change of command. I thought, my Lord of living, we're not going to see our general in a sweater vest. But lo and behold, we end up seeing him. And bless your wife. God bless her for doing this for me today. You know, but a great change of command. We've got a wonderful Brigadier General and General Crane that's taken over. But what a job that man right there did. And I'm so happy he's right here still with us and going to be with us and going to be doing great stuff at WVU and Hyperloop and wherever it may be. I mean, General Hoyer, what a horse. What an incredible horse. I mean, a thoroughbred through and through, and I can never thank him enough. Superstar beyond belief. I'm going quickly because the White House has invited me to come on a briefing at 1:30 about COVID. They want to hear about West Virginia. That's all there is to it. You know, I've been through the stuff about the Greenbrier. There was a mistake made, and I want to go through this and everything, but yesterday an employee of our General Services Department accidentally hung the U.S. flag upside down on the east wing rooftop flagpole. Now, it was this gentleman's first time hanging the flag, and he was switching it out midday because the old flag was becoming tattered and worn. He wanted a brand new flag to fly high over this wonderful Capitol and everything, so that we can appropriately honor our country. Now, he's apologized over and over for his mistake, but this gentleman feels bad. We all make mistakes, don't we? I mean, this gentleman feels bad. We don't need to humiliate or throw stones. We all make mistakes, and we should love this great man and everything and all the goodness that he was trying to do. So just think about him too, because he could probably use a couple of your prayers as well, because these great people that do this work around here every day, they're stars. That's all I got.
All right, thank you, Governor. Our entire panel joins us, but in the interest of time, we're going straight to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping someone could give us a little bit more detail about the vaccination clinics. Could you walk us through how this is going to work? Are folks going to be able to stay in their cars like they have with the testing? Do they have to make an appointment at all of them? It looks like it kind of varies. Could we just have a little bit more info on that process? Thank you.
General, go.
Yes, Charles. So it will vary based on the locations and the organizations doing the events. But in working with the governor on this new rollout of Save Our Wisdom, we are going to ask our local health departments and other organizations participating to work with the appointment process. We believe that is the most effective and efficient way to do it, and it prevents people from showing up and then us running out of vaccines. So they can check with each of the areas as it occurs, and they will inform them of whether there will be organizations that will have people come inside or otherwise. One of the things I will point out is we continue to manage a couple of issues that have come up where bringing the vaccine out in the syringe with a temperature change potentially causes the vaccine to evacuate from the needle and the syringe. So we have to take all those things into account and work through those. But please ask individuals to work with the local area and the organizations that will be running those events, and we will continue to try to press information out where possible.
Let me say one other thing while the general's here and everything. But General, I think we should tell the people that we're going to have X number of vaccines at each one of these locations and everything. Could you explain that just 1 second?
Yes, sir, Governor. We are attempting to get, based on availability, as many as 650 vaccines at each location, if those are available based on what we have put through the system so far. And then as these clinics continue and vaccines become available, working through what the governor's directed us to do, we'll continue to increase those amounts. The other thing that you will see coming up is additional capabilities coming online, like hospital clinics and other clinics and primary care providers.
If I could just add one follow up on that too, and General, you may be able to confirm this, but I think Tucker County, said that they had pretty much gotten all their 80-year-olds. Is that correct? Was that Tucker County? Or audio, General, you got to do the audio. Okay. Was it Tucker County? Okay. But what the good part, what we'll do is we'll fall right back in very, very quickly and start getting 70-year-olds and up. And if we've missed somebody that's 80, all they got to do is come and everything, and we'll get it. But we're really moving on this and everything. And the good part about this, and I can't feel any better about this because, we can kick in a lot of different directions. But are we out? We're really going to miss Jordan around here. Jordan does a wonderful job, him and Mitch, and all these beautiful ladies that are doing the signing and everything, and that's really important. But I guess what I was saying is just this is, this Operation Save Our Wisdom, is really, of course, that's my idea from the standpoint, so if it's your baby, you want it to go really good. But what really makes me feel the very best about this whole thing is we've given hope back to our elderly. And we've given hope that we're going to try every way within us to be able to get them vaccinated because they're dying. And absolutely, we're doing it. And I give all the credit in the world to the health departments and our health community here and our health experts and General Hoyer and all the different work that the Guard's doing. Boy, this is really important. So yeah, if we can keep this going, this is really good stuff.
All right, Governor, I apologize. We had a slight audio issue there for a moment. We'll go to the next question now. It's from Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here. And this is a question for DHHR. I apologize if this has been addressed at some point over the last couple of weeks. But why does the state add both confirmed and probable COVID-19 cases when calculating the percent of positivity? And when did the state start doing that? It kind of looks like it kind of makes the number look worse than what it might appear, even though obviously cases are up. Could someone explain that? Thank you.
Secretary Crouch, go.
Yes, sir, Governor. PCR tests, as you know, Steve, are gold standard, and we've followed those all along and made sure that we were accurate with those numbers. We, several weeks ago, began to look at the positive tests. Positive antigen tests are probable tests, but in order to be more accurate, we've added the positive antigen test, if there's a test, in with the negative test so that we are more accurate. So over time, we've tried to be transparent and make sure those numbers are available to everyone. So in the essence of being accurate, more accurate, we've added those numbers.
All right, thank you, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I want to introduce myself to the gentleman in the Ferris Bueller sweater vest. I don't recognize him, but thanks for joining the panel. It's good to have you with us. Governor, I do have a question for you. When you talk about talking to the teachers and communicating with the teachers, do you have a plan specifically on how to do that? Are you going to include the union in those talks? Are you going to circumvent the union because you believe that's a lost cause and you're going to talk directly to staff members? And if you are going to talk to them, you're talking about virtual forums. You're talking about things like this on YouTube. How are you going to deliver the message that you want to get to them, and how are you going to get the information from them that you say is critical to moving forward in the process? Thank you.
Well, Kenny, here's the bottom line. The bottom line is, it's almost like do you want your eggs scrambled or fried? And it's yes. We're going to use multiple means to be able to have discussion and have productive discussion and everything with the teachers and the service personnel, the members themselves and everything, because I have without question, I have absolutely delivered in every way, to that community of people and everything. Now, me, I just tell it like it is. The teachers' unions ran off in a direction and supported my opponent and lost every single county in this state. Every county. For crying out loud, the teachers themselves and the service personnel themselves, they spoke, not with their union. There's no point in me really talking to their union leaders. If I, in fact, were paying dues to somebody that took me in a direction and lost every single county in the state, I'd really be thinking about it. I'd be thinking about, is this representation what I want? But we need to talk to them because they're worried and they have concerns just like all of us. They're legitimate concerns and everything else, and we need to talk. And I'll be open to continue to talk and everything else, but I don't want just hoopla talk. I'm all about results, and if you look all around us and everything and what we're doing, for crying out loud, just look at the rollout and what we're doing right now with the seniors. Look at trying to go back to school with our middle school kids and our elementary school kids, and we know that transmission is minuscule, and look at the effort to try to vaccinate our teachers and service personnel and all the different stuff. And more than anything, watch the news. Watch the news. I hate to say this, but I sat with our great general, and I sat with our great Dr. Marsh, and I said, and here's exactly my words, and they'll tell you, and there's no point in dodging and everything. They have bailed me out so many times, it's unbelievable, but I said just this. I said, guys, you're about to get your butt caught in the door, and you don't have any idea why or what it is. And they looked at me like I was crazy, and I said, you know what it is? And that is just this. You're going to hear a knock, knock, knock on the door, and they're going to tell you really quick that all the cupboards are filled up with vaccines, and then what are we going to do? When there's more here, what are we going to do? So we got to find a way right this second to get those vaccines in people's arms. Well, at the end of the day, that's what you want me to do. That's the kind of stuff you want me to do. From the standpoint of our teachers and everything, I truly value their component in every way. I don't know how in the world that we got so misguided, especially from the standpoint of a governor that truly did everything that any governor could possibly do for the education and the service personnel community.
All right, thanks, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Wondering about the rollout of vaccines for 80-year-olds. One thing I'm wondering about is how the 10 clinics described around the state may differ from what local health departments are doing already. They're already obviously trying to work through the 80-year-olds in their community, already making appointments. So how will the clinics be different? Also, it sounds like some of the health departments are having trouble predicting when they may get a supply of vaccine. Is there a way to make that more predictable and sustainable for them? And one final aspect of that, I'm sorry I'm going on here, but are health departments handling senior citizens while local pharmacies are vaccinating communities like businesses and associations? Given the supply issue right now, would it be better to make a decision to emphasize one group, senior citizens, versus another, the businesses and associations? Thanks, and sorry for having subplots to my question.
Well, Brad, thanks a bunch, and I'm going to defer to our general, but I'm going to just say just this. All the wrinkles that you're talking about are the challenges. And if you'll just look at Florida right now, where you've got seniors that are sitting in line all day and then don't have, then they don't have enough to go around and whatever it may be. And I've said over and over, that we can only do what the resources are available to us to do. General, you step in there, but a lot of wrinkles, a lot of moving parts, but that's what we're supposed to be doing.
So, Brad, as we talked about early on, the governor established a joint interagency task force. It's on the drill hall floor at the Coonskin Armory. And we've got representatives from the Dr. Deb Keister, Marshall faculty member who represents the local health departments, Board of Pharmacy. We have the associations and the licensing boards come in regular. Marty Wright from the Healthcare Association, the Hospital Association, and all that gets coordinated at that level. So the clinics, look at them as just an additional outlet with more throughput. But one of the things that we discussed with the governor in detail the last couple of days and his push to us is, if you look at it, what we've been doing is pushing vaccines out. And now what we're doing with the appointment process and more outlets is creating the situation where we're both pushing vaccines, but we're pulling people in by scheduling appointments for those groups and making it orderly. One of the things we discussed and the governor was clear on was move, but don't create the circumstance that we're seeing in other places around the country where people show up, spend 6 hours, spend 10 hours, and then still don't get a vaccine. So working through that. To your question related to balancing the piece, as the governor pointed out, this is clearly a balancing act. And we know based on the data that we had to get long-term care facilities and those elderly and vulnerable populations in congregate settings and the workers. We knew that we had to get our healthcare workers to maintain the integrity of the system. And everything goes back to those guiding principles the governor gave us about taking care of our most vulnerable, reducing deaths, maintaining the integrity of our critical services and our healthcare system. So I guess people could say, yeah, there's 100 different ways to do this. We're doing it the way we think best fits the state of West Virginia and try to create that balance that the governor's asked us to do.
All right, thank you, Brad. Next to Mark Curtis with Nexstar Media.
Good afternoon, everyone. From Mark Curtis in the Nexstar Media newsroom here in Charleston. This is perhaps a speculative question, and I'd like our two medical professionals on the staff to respond in addition to the governor. It's speculative because obviously schools aren't supposed to open until 2 weeks from today, and a lot can change. But looking at the state map today with 47 counties in the red and 8 counties in the orange and none in the safer levels below. We're getting a lot of calls from teachers and parents alike concerned about whether opening school for in-person learning on the 19th is really a wise thing to do. Will there still be options for online learning for families that don't feel safe going into the schools? And how much flexibility is in your order, Governor, and how much might change between now and then based on these map colors?
Well, Mark, from the standpoint of flexibility on the online learning, absolutely, that's there, and I think that's completely built into the process and everything. And so, from the standpoint of parents deciding, that they don't want to go, bring their kids to school and everything, that's their call, And from the standpoint of adjusting that date more and everything, I really think that we're moving ahead. And it's more of a question really for Clayton Burst, because Clayton and the Department of Ed and all those people, they're coming up with those dates. But I think from my standpoint, the feedback that I'm getting from everybody is we're targeting the 19th and we're moving full steam ahead on the 19th. But Mark, you got to know, and it's as simple as mud, but really and truly, we've got to be willing to pivot. And this thing is a very fluid situation, every bit of it.
All right, thank you, Mark. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is kind of a follow-up on Mark's question and something the governor has referred to in past press conferences. I want to talk about the schools as a social services safety net, and I'd like to ask Secretary Crouch how on a percentage basis, how many referrals do they get as a result of observations made in the schools for abuse, neglect, additional social services? Thank you.
Crouch, go. You know, this is a big part of our decision making, Paul. You know, from just, and it is Paul. Is that correct, Jordan? Okay, that was a big part of our decision making process because, you know, Secretary Crouch, you know, we'll talk in just a second, but he said it so well. I mean, honestly, I mean, guys, you know, if we're not in school, I mean, there's a lot of bad stuff that's going on. And if we don't have eyes on people and everything, or kids, we miss a lot of bad stuff. So, Secretary Crouch, go.
Yeah, thank you, Governor, and thank you, Paul, for the question. This is a huge concern to DHHR and our Bureau of Children and Families. We were averaging, if we look at 2019 versus 2020, back in January and February of 2019, we were averaging about 3,800 to 4,000 calls a month for potential abuse and neglect. About 62 to 67, 68% of those calls are substantiated or have been substantiated in the past. In 2020, during April and May, those numbers dropped 50 to 54%. So we had a huge concern that we didn't have a second set of eyes on those children, and we didn't have enough people looking out for our children. Teachers are the largest portion of those calls, are the largest segment of those calls. So again, without teachers having eyes on those students, we don't get the number of calls. And everyone thinks that the home is the safest place for children. That's not always the case, unfortunately. So we have a huge concern there that we need teachers to have eyes on these children and to help protect these children. Those numbers have increased somewhat as through the summer and as we got into the fall. And I believe at present, those numbers are somewhere around 70% of the calls that we normally get or that we received last year. So we still have hundreds of children that we're concerned about out there. We want teachers to be a part of this safety net. They are a huge part of the safety net. And as the governor said, this was a large part of the decision to see if we can get our children back in school. So thank you for the question, Paul.
All right, thank you, Paul. Next to Aaron Williams with WBOY.
Governor, I'm going to stick with the school theme for a minute, and I just want you to know I ask these questions as a parent who's found out that I'm a much better journalist than I am a second grade teacher, and I can't wait until it's safe enough for my son to get back to school full time. That being said, since you made the announcement about the 19th, several counties across the state have come out already and said that they won't be going back full bore on the 19th. Based on the recommendations of their local health officials. They're going to stick with blended learning models. They're going to continue to use orange on the maps. So I guess I would ask, what's your reaction to those kind of decisions? And then secondly, you and Superintendent Birch have said several times that virtual learning has been a failure. Again, as a parent, I'd tell you, it doesn't hold a candle to in-person learning, but it's not something that's going away real soon. So if you could maybe tell us what's being done at the state level to improve virtual learning. Thank you.
Well, first of all, let me talk just a second about, you know, superintendents saying, you know, they're not going back and they're going to a blended model and whatever like that. We want we want local control. You know, we do want that. But I can tell you that Superintendent Birch is talking to these people and everything, because everything was brought to me that the superintendents across the state, as you know, almost entirely are saying they're crying out for some way, somehow, for us to get in front of our kids and have, you know, in-school learning. You know, now, So we surely will have issues there. I mean, just think about this. I mean, guys, I got 2 texts last night that were people that were Board of Education members. And the 2 texts I got were basically saying, you know, we as a board, we have people that are on our Board of Education that are not maybe the strongest members and everything, and they're getting bombarded by the teachers' unions pushing us not to go back to school. And they didn't like it. They didn't like it at all. You know, I really think that the local control and Superintendent Birch, they'll work through this and they'll figure all this out and everything. And the second part of the question again was, you know, the virtual learning. I mean, the virtual learning aspect and everything. Let me just say just this. You know, you're probably doing a wonderful job with your child, and there's no question about that. You know, if we have loving parents or grandparents or whatever that are in the home that are absolutely helping children and everything, the virtual learning is, you know, fairly successful. But the situation is so easy. A lot of these homes don't have that. And a lot of homes are single parent homes, and the single parents got to work. And so you've got every situation. But we're continuing to try to work with Superintendent Birch, and you know, and we're working every way we possibly can to try to make the virtual learning even better. But we all know just this, that these homes, no matter what home it may be, is a loving, caring, absolute home. And they want the very, very best for their children. And we know if we can get them in school, that absolutely the transmission rate really of kids that are middle school and under are so minuscule it's unbelievable. We got to get them back in school, everybody. There's just plain no substitute for being in the classroom. And we got to do it for everybody. Everybody. We've got to help all those that are out there that are struggling to make ends meet. For crying out loud, just think of what this has done. Think about what this has done to everybody. You know, whether it be those that just lost their job out of nowhere for no reason, no fault of their own. Absolutely. Just think of how Washington has jerked around everybody over and over and over and couldn't pass the stimulus package. Just think of what has happened to all of our small businesses and everything. You know, thousands and I think hundreds of thousands of restaurants that are failing and everything. I mean, people just hanging on by a thread. It's been tough. It's been really, really tough on those people. So we do know if we can get our kids back in school, it'll be really good for the kids, and it'll be really, really good for all those that are wondering how in the world they're going to take care of them at home and work too.
All right, Governor, it's about 1:30. I'll turn it back to you.
Well, I hope we got enough questions and everything, and forgive me for all the that we had to discuss today. And I want to go and jump on this call real quick, but if you got any other questions and everything on Friday, we'll answer them on Friday. And just I want to say one thing really quick, and it's just this: for those people out there that are concerned about playing sports and going back to school and everything, of course, just give us time. Just give us some time to be able to address getting the 80-year-olds vaccinated, getting the 70-year-olds vaccinated, getting all that in process and really rolling. We're not even going to go back to school till the 19th, you know, but what may very well be, we may very well be able to do if we start seeing this thing ease up and really moving our way and everything, maybe we'll go back to start practicing and everything, get your number of practices in, where on March 1st we'll hit the button and be able to start playing ball and doing those kind of things too. Just give us some time. Everybody's working as hard as we possibly can. Thank you all so much.